Do you or your partner suffer from erectile dysfunction? Is erectile dysfunction affecting your sex life? If so, stay tuned and we'll be talking about the most common causes of erectile dysfunction and how to treat it. Welcome to the Pharmaca channel. I'm Matthew, the patient care specialist, and I'm going to tell you all about erectile dysfunction, how to identify if you're experiencing it, and how to treat it. If you like this video, remember to subscribe and click the notification bell so you don't miss out on any of our latest videos. So, what is erectile dysfunction? Erectile dysfunction, also known as impotence, is the inability to obtain an erection and sustain it for long enough to engage in sexual intercourse. Erectile dysfunction is a very common condition amongst men, particularly once you reach the age of 40. In most cases, the episodes are caused by stress, anxiety, lack of sleep, or excessive alcohol intake. For some men, these can be a single episode which can self-resolve and are nothing to worry about. However, if you find that you or your partner are regularly suffering from erectile dysfunction, this may indicate a more concerning medical or psychological problem. A number of factors can increase your risk for the development of erectile dysfunction, and each factor may need to be addressed individually. Lifestyle factors, which include being overweight or having a history of smoking, excessive alcohol intake, or illicit drug use. Mental health factors, things like anxiety and stress, can dramatically influence your ability to get and sustain an erection. For some patients, having a hormonal imbalance can play a role, such as having a low level of testosterone. Some prescribed medications can also cause erectile dysfunction, such as antidepressants and some antipsychotic medications, certain blood pressure medications, and testosterone blocking medications, which are commonly used for prostate issues. If you have a history of cardiovascular disease, this may also indicate that the blood vessels supplying the penis are also affected. What are the next steps? After reflecting on the factors outlined previously, you can either consult a doctor or complete a free online questionnaire at pharmaca.co.uk to see if there is anything that would suggest if some ED treatments are better than others. So, what treatment is available for erectile dysfunction? What can be done to help? Treatments for the management of erectile dysfunction are effective in the vast majority of patients. However, it is important to recognise that the management of each patient's erectile dysfunction is likely to be different and will be dependent on the individual cause. Where stress and anxiety are the precipitating cause, you may benefit from psychosexual therapy. Here you'll be given the correct tools to manage your anxiety and stress levels, which in turn should improve your mental well-being, but also the symptoms of erectile dysfunction. Improving lifestyle factors, such as reducing alcohol intake, stopping smoking, and avoiding drug misuse can help with the treatment of ED. Keeping your weight at a healthy level can also be beneficial, and either a dietitian or your own doctor can help you with this. So, what about medications? You've probably heard of Viagra, also known as sildenafil, perhaps one of the most famous medications to treat erectile dysfunction. This is a medication that is available from online pharmacies like pharmaca.co.uk. These medications are taken prior to intercourse and are effective in around 3/4 of patients. Can I use a vacuum pump? Vacuum pumps work by creating negative air pressure, which encourages blood into the penis. This option can cause a little bit of bruising. Thanks so much for watching. We hope you've found this information useful. If you've enjoyed this video, why not subscribe and be sure to click the notification bell down below. Of course, this video does not provide any individual medical advice and it is intended for informational purposes only. If you believe that you may have a medical emergency, immediately call your doctor or ambulance service. Thanks for watching. We'll see you next time.